So another talk for Jerome Razanamahery. Jerome here? Oh, here he goes. And he's going to talk about MAPK-kinase mutations in aortic lesions and the effect on circulating monocytes.
So thank you. I want to present this work about MAPK-kinase mutation and aortic lesion and the distribution of circulating monocyte subset in patients with histiocytosis disorder. So for the background, we know that histiocytosis disorder are clonal disease with MAPK-kinase mutation, and we know from a work from Matthias Papo that there is a monocyte subset disturbance in patients with ECD. And if you look at it, it resembles to CMML because there is an increase of the classical monocyte and the decrease of the non-classical monocyte compared to control in untreated ECD. And then we did another work to show that there is some difference between patients with histiocytosis compared to essential thrombocythemia, but it stays close to CMML. But we know that some patients have aortic involvement, they can have a systemic inflammation, and it can mimic vasculitis, especially giant cell arteritis. So we wanted to know the impact of the clonal signal, the inflammatory marker, and of the vascular involvement on the distribution of the circulating monocyte in patients with histiocytosis disorder. So if you look at all the subsets, so there is 3 subsets. The classical with implicated in phagocytosis, they're considered inflammatory. There is the intermediate, which are implicated in antigen presentation. This is a bridge between the classical and the non-classical, and they usually consider as pro-inflammatory, but they can, in certain situations, produce some IL-10, which could be anti-inflammatory. And you have the non-classical, which are implicated in endothelial surveillance. So we perform analysis on the peripheral blood cell with cytometry on what? Yeah. So it's okay. Yeah, so we took the blood sample with the flow cytometry of a patient with histiocytosis disorder, LC donor, and we took control with patient with GCA before the starting of the steroid. So this is the distribution of the patient with histiocytosis disorder, mostly ECD. The BRAF-Wissing syndrome E mutation were in patient mostly with ECD, 1 patient with LCH and 1 patient with mixed ECD-LCH. We had 2 patients with MAPK-1 mutation, 1 in ECD and 1 with Rose-Dorfman disease. So a total of 22 patients with no identified mutation on tissue biopsy. 13 patients had clonal hematopoiesis, and 9 patients with histiocytosis disorder had aortic lesion. So first we want to see the difference between patients with histiocytosis disorder, GCA, and LC donor. And the difference that we saw is that there is fewer intermediate monocyte in patients with histiocytosis disorder compared with patients with GCA. So as I told you, it can be pro-inflammatory subset, and we compare with the CRP level, and as expected, the CRP level was lower in patients with histiocytosis disorder compared to patients with GCA. Then we wanted to see if the difference was associated with BRAF mutation or MAPK-kinase pathway mutation. So when we do the comparison, if you look here, the patient with the MAPK-kinase mutation, they have an increase in the classical monocyte. So it seems to be closer to what we see in CMML, and there is a difference compared to GCA patient. There is still the decrease in the intermediate monocytes, and there is also a decrease compared to LC donor, what was seen first on the paper by Matthias Papo, and because of the MAPK-kinase mutations, most prevalent was BRAF. This is the result that you have in patients with BRAF mutation. So with that, we can say that the difference are due to mutation in the MAPK-kinase pathway. There is low CRP level and a decrease in the intermediate monocyte compared to GCA. And then we wanted to see if the presence of aortic lesion could have an impact on the circulating distribution of the monocyte subset. So, as I said, the patient with aortic lesion with histiocytosis were 9, mostly ECD. And if you look at the difference, there is an increase in the classical monocyte, but the most important is the decrease of the non-classical monocyte. And as I say, the non-classical monocytes are implicated in the endothelial surveillance, so maybe there is a recruitment of the circulating monocyte on the aortic site, and that's why maybe there are decrease in the blood. We look at the difference in patients with GCE with and without aortic lesion, and there was no difference. And then we try to analyze if there was an impact of a specific MAPK-kinase mutation in patients with aortic lesion, but here there is a difference compared to patients with GCA without aortic lesion, but there was only 5 patients, so it's really, we cannot, I think, conclude on that. And then we try to analyze which were the factors associated with aortic lesion in this cohort. So in the multivariate analysis, there is a correlation between aortic lesion and ECD, and also with CRP level. So this is what you can see here on the correlation model. So a correlation between CRP and ECD. This was the two only factor that was significant on the association with aortic lesion. So MAPK-kinase mutation altered the monocyte subset profile in histiocytic disorder. The distribution is distinct from a pure inflammatory disease like GCA, and the decrease in non-classical monocytes seems associated with vascular involvement. Of course, there is a limitation because it's a small sample size, and there is a different type of histiocytic disorder, so I don't know if we can conclude it for all histiocytic disorder. There is an age mismatch with LC donor, and in patients with histiocytic disorder, they had some treatment before, so maybe there is an impact of prior treatment. The future direction, we wanted to see on single-cell study the effect of the mutational burden and all the cytokine expression in different subsets. Looking at the longitudinal analysis with treatment and see what kind of treatment can make a difference on the subset, and maybe the monocyte can be a therapeutic target or a biomarker for disease activity. So to conclude, I would say that MAPK-kinase gene mutation influence the distribution of the circulating monocyte. The distribution is associated with a low inflammatory state, and the aortic lesions are associated with ECD and elevated inflammatory marker. So I want to thank the team from Dijon, the team from PT Salpêtrière, and my colleague in Italy, and of course all the patients. Thank you for your attention.